Edward Hain Hospital opened 96 years ago. It has 12 beds and operates some outpatient services. It's owned by the NHS Property Services company, who intend to lease it to the Cornwall Partnership Foundation Trust, who took over providing Cornwall's community health services in April 2016. As part of the transfer of the lease, an inspection of the property showed up issues with the building. As works were being carried out to rectify them, more issues showed up, especially concerning the safe evacuation of patients and staff in the event of a fire.
We took over the running of the services in April. At that point, Edward Hain Hospital was already closed, had been closed in the March for fire safety reasons. So consequently, we'd focused much of our effort on looking at the other 12 community hospitals within Cornwall, doing the surveys, making sure the work was there. Obviously, once it got closer to the point of Edward Hain and the work being done to fix the fire safety, we reviewed the fire strategy. In reviewing the fire strategy, we suddenly realised actually you couldn't get the beds out of the rooms, and we were told by the staff that actually the beds were built in the rooms and never designed to come out. Now clearly that's a flaw that couldn't really exist within a community hospital.
But in Edward Hain it did exist, meaning any fire would require drastic measures.
So the ward is a 12-bedded ward. It could have a mix of patients on the ward. So we may have patients that can walk. We may have patients that require lifting into a wheelchair and then can be pushed out, or we may have patients who need a lot more help than that.
So we talked to the staff, and the evacuation procedure they've used is these Alamac mats, which means you transfer the person on the bed into the mat, you then lift them down onto the floor, and then you drag them out of the building or drag them to the next safe zone before removing them from the building. This isn't ideal and has a number of risks associated with it, but clearly previously was seen as the best possible solution.
If you're an elderly patient, that is not comfortable by any shadow of a doubt, and also you could injure somebody actually pulling them out as well. So the patient could have more problems post an evacuation than when they actually were admitted to the hospital in the first place.
Clearly in a situation where it's a choice between that or burning, then it's much better to actually get the person out of the building. But it's not a really safe evacuation procedure, and there is a risk that you do more harm than good in going through that evacuation procedure.
That full evacuation procedure will be triggered even for a false alarm. With only 3 duty nurses, moving even a few patients using the mat while also trying to help the others was a challenge to both patients and staff, a situation that has to change.
So the point that we're at the moment is NHS Property Services, who own the building, we're working with them to get the fire rectification work being done, and we've now said to them what we need to do is have a situation where the hospital can be designed so that it can have bed evacuation on one level. We're looking at 3-4 bedded bays to maintain the bed stock at 12 beds, and what we need them to do is to come back to us with their proposals, their plans and their costs for doing that work, so that we can review that in the light of the overall community hospital estate in Cornwall.
And what's the time scale for this? When can patients be expected to come back in?
I think this is a major piece of work. I can't predict how long builders will take, but I would say this is going to be in the period of months. This isn't going to be quick rectification work. It needs to be done and done safely, and if we do it, it needs to be done in a way that gives a long-term future to the hospital.
The Trust is adamant this process is not a smokescreen for a closure plan. It's simply to ensure the provision of new, safe fire evacuation for patients and staff, and they have an additional strong incentive.
If we maintain the status quo and open the hospital, then me individually and the Trust would be open to a charge of corporate manslaughter, because actually we cannot guarantee the fire safety of this building, and we know that. So to knowingly do that would be a criminal act that we could not tolerate.
So you have to go through this process?
We have to go through the process. We have to ensure that we have safe facilities for patients and for staff. Otherwise it is corporate manslaughter if something were to happen.
The Trust has a duty of care to its staff and patients to provide the best possible community health services in safe and appropriate buildings which are fit for purpose and provide the best possible standard of care to local people. They are committed to providing their stakeholders and members of the public with regular updates about the provision of services at Edward Hain and other sites. This information can be found on their website at www.cornwallft.nhs.uk.